What a year we've had. It's been exactly 365 days since the first case of COVID-19 was detected in South Africa. So let's reflect on it all. The last 12 months, healthcare workers are describing the past year as a crazy and sometimes hopeless time. eNCA's Ayesha Ismail is at the Tygerberg Hospital in Cape Town. Ayesha, you've been speaking to doctors about how they've been dealing with the pandemic and some of the losses that they've also experienced. What have you heard?
That is correct, Tulas. That was earlier where I spoke to three doctors who, talked about the planning and the preparation that went into dealing with the COVID-19 pandemic. And, of course, they talked about success stories, but they also talked about the fact that especially during the second wave, they lost loved ones, they lost colleagues. And as you know, the Western Cape was hard hit during that time. We were also at one time the epicentre of the pandemic. But of course now the numbers have decreased significantly in terms of infections, hospitalizations as well as deaths. But I'm now joined by Dr. Smith, who is the head of disaster medicine. And you were telling me that the Western Cape started planning in January last year already.
Yeah, that is correct. Basically what had happened, we were watching what was happening internationally and realized that there was a possibility that something could come through the airports. So we pulled together the colleagues from eNCA, the Airports Company of South Africa, as well as Tygerberg Hospital, and started fairly intensive planning, including dry runs of patients, taking them through the system, making sure they could get to hospital through a different route, different to where the normal patients would go. And so we started in the middle of January in that type of planning space, yeah.
And then, of course, we saw the building of the first field hospital, the CTICC, being converted into a world-class field hospital.
So again, watching what is happening internationally, I remember fairly clearly the 1st of April asking for a meeting with the CEO of the CTICC and taking an architect with us just to see if it was going to be feasible. And, I then moved on from that meeting, and a couple of weeks later, or a couple of months, I think it's 2 months later, the CTICC was open. So I think a lot of what this has happened, or what's happened in this space, is teams, different departments, different sectors of society working together to a common goal. And I think in disaster medicine, and particularly in this province and in disaster management, we've done these type of projects in the past, not to this scale, obviously. But we have a trust with our fellow departments. So, for instance, Public Works, who we brought online to help us with transport of patients into the Q&I space, making use of the taxi industry, which freed up a lot of the ambulances to help. So, there was a lot of planning that happened. I think, I said before, I think we started off jogging, early stages. And then as we were trying to ramp things up, CTICC and other projects, it became a bit of a sprint. I think we then going and started pacing ourselves and slowing up as things have happened, and more pressure was in on the hospitals and in my particular space of trying to get things sorted. But the second wave definitely has exhausted many of the colleagues. A lot of it, as I said once before, I think it moved away from just being numbers and statistics to persons' names. I think all of us have known people that have succumbed to the disease. And I always get a little bit worried that, what's going to prevent a next wave of it? And it's in the public's hands. I think the health department and its other agencies can only do so much. We have the vaccine coming out now, which is obviously a very important tool in the arsenal. But I think, we're seeing less mask wearing, we're seeing people not washing their hands, and we're really going to need some assistance in that space. So I think a lot of it is in the public space now to help us to get over any future waves of COVID-19.
Now, if I remember correctly, the first confirmed COVID-19 patient in the Western Cape was on the 11th of March. Yeah. What went through your mind when you became aware of that first patient in the Western Cape?
There were a couple of patients. There was a lot of what we would call the case definition. So there were patients that fitted a case definition. I remember very early on being phoned by an airline, the international airline, to say there's someone presenting to hospital. He's going to just go to one of the hospitals, but they think he may have COVID-19, and we managed to intercept him and bring him through to Tygerberg where they could do the testing. Unfortunately, he tested negative, and we had lots of cases like that before patient zero. So once patient zero arrived, we were hoping that we had robust systems in place that we could detect and that we could manage it. But, you know, as we probably know, or as the first patient didn't come necessarily through the airport and straight into the health system, through this system that we had planned, he self-presented to one of the hospitals. And thereafter, you know, we put the screenings and stuff in place with the assistance of the South African Defence Force that helped us at the airport to help Port Health. So the collaboration all started taking shape and has worked really well for the last year or so. You know, it amazes me that it was a year ago. It's like a blur. Some of the things I can't actually remember seem to have happened such a long time ago. But a lot of the systems that we have put in place is just in good stead for future activities.
So you are well prepared for the, we did hear from the head of health just in the week saying that there will definitely be a third wave.
Yeah.
How prepared are we for that?
You know, I think anybody that says, you know, we're 100% ready for it is probably being a bit foolish. I think we're learning all the time as things change. We've also taken the opportunity as the activities have come off and the patient numbers have decreased to say, look at our oxygen capacity, how we can boost that in this period now that we're in. And I think most importantly to allow staff just to reflect and to heal. And that's very, very important as staff ready themselves for the third wave. So we're not going to sit back on our laurels and say we're ready, you know, let's see and bring on the third wave. I think we're going to fight very hard to prevent it and hopefully we can keep it with the public's assistance to lower numbers than we saw in the second wave.
Dr. Smith, thank you so much for your time. And Tula Sizwe, again, we're hearing Dr. Smith echoing what the other doctors said this morning, that while the doctors will do, and also the healthcare workers will do whatever they can, the public must also play their part.
Yeah, eNCA's Ayesha Ismail there with that update as we look back on the last 12 months of living with the coronavirus in our communities. In fact, let's